Pediatrics is an interesting environment, particularly the tertiary quaternary care, which we focus on. If you look at the predictions, first of all, of course, we have a falling birth rate. We also know that care is shifting increasingly from inpatient to outpatient. And that's critically important, particularly if you're looking at a child and the family. You know that healthy development occurs best at home. So while that is occurring, at the same time, there is a shift of pediatric inpatient care from adult systems that also do some pediatrics to these independent pediatric specialty sites like ours. So we are working collectively with our community to understand, as all of us face financial pressures and a lack of pipeline for specialty expertise, how do we be smart about this? Where does an adult health system say, look, we're looking at stroke, pediatric stroke below certain age. We, the adult health system, shouldn't be in that in any way. We're going to ask you to look at your services there and expect that we are going to be sending those patients to a pediatric specialist to get that care. So while inpatient pediatric care is decreasing, independent pediatric hospitals are actually getting prepared for an influx of those more complex patients that our adult systems aren't comfortable caring for. Those things tend to be more complex areas, and those are the areas that we're leaning into and that we're seeing growth in. So we're currently quite focused on neonatal, but I'll expand beyond neonatal. That's inclusive of fetal care and fetal intervention, cancer and blood disorders for pediatric patients with oncologic or hematologic problems. Our ENT, ear, nose, and throat, and our head and neck surgeries are an area that we're increasingly seeing complex cases referred to us. Neurosciences is an important comprehensive service line that requires particular attention with the growing brain. So those are just, and then of course cardiovascular, where congenital anomalies really require the specialty of surgeons who have focused their entire career on doing these kinds of repairs. So those are all areas that we are continuing to invest in, we're continuing to see growth in, and we're ensuring that we're available as our state's largest pediatric specialty provider to receive patients who need our care from other systems.